Hello and welcome to the Days of Learning podcast. It's so exciting today. We have our biggest podcast ever. The Days of Learning podcast is about how we connect community to healthcare and healthcare to community. Nothing gets me more excited than talking about next generation, whether it be working with kindergartens or working with postgraduates. And sometimes there's a lot of similarities between kindergartens and postgraduates. But today I'm really overjoyed to have a whole cadre. We almost have a basketball team, I think, of medical students from the first year of medical school, M1, to the fourth year of medical school, M4. So I'm really pleased today to have Delaney Weiland from Chicago. She's an M1. Celeste from Berkeley out in California. She is also an M1. Ramneet Mann from Toronto. Josh Matzke from Central Illinois as an M3, and Ramneet is an M2. Meg Corey from West Texas, and Bradley Julga right here from Milwaukee. Welcome, everybody. Good to have you on the podcast today.
Good to be here. Hi.
Good to have you all.
Thanks for having us, Dr. Nelson.
You are welcome. I'm going to get right into it because, there's never enough time, and when you guys have a lot to say. I want to start with Delaney and Celeste. You guys are just starting your journey a couple months in. You've had some exams. We're in a pandemic. Man, tell us how this journey has begun for you. Celeste, I'm going to start with you.
Yeah, well, I also moved out here from California, so it's been a really interesting transition, not only starting graduate school. I'm 3 years out of undergrad, so that has been an adjustment, but also, trying to create community in a completely new state, amidst COVID. So that's been a big learning curve, but honestly, it's been really great being here, finally starting medical school after such a long journey. I knew that I wanted to be a doctor going into college. So finally getting to be here, I'm just really happy.
Oh, that's so cool. Celeste, I just want to ask as a follow-up, how has that 3 years between ending school and beginning school again, what has that taught you?
Yeah, it taught me more than I can say. I did various different things in each year. I was a scribe in a safety net hospital out in San Francisco in the emergency department. So that's kind of where I really began to find an interest in healthcare and equity and health disparities and working in that kind of community. And then I also did a lot of global work. So I was in Guatemala and I worked in Tijuana with refugee populations. So those experiences really opened my eyes to the global health disparities and how I want to participate in medicine and what I can do as both a medical student and a future doctor.
Yeah, you're really doing a nice job of laying it out, that idea of safety net and global health and local health and how it connects in. Thanks for the quick introduction. Delaney, come on in and tell us about how it has been for you in the pandemic and starting medical school.
Yeah. Hi, everybody. I'm Delaney. It's been really, I think, like Celeste was saying, an interesting time for everybody, just sort of transitioning to more of an online format just for living in general and working. But I think I've been surprised by how special communities have been even in this time, and how communities still have been able to be formed, whether it's with classmates or like getting to join the street life group. So I think it's been special to have those communities sort of develop in a new place. Like, I'm not from Milwaukee, so I was sort of nervous about, coming to a new city during a pandemic. But yeah, the communities that have been built here that have become part of my life have definitely made the transition a lot smoother.
So I want to ask you, Delaney, because you bring up that wonderful word community, and you mentioned a community, and we think community is not just a geographic place, but it can be a place in our heart and our minds. But you mentioned student community, and you mentioned outreach community. How have the two helped you to see what's important in this space?
Yeah, it's a good question. So this is sort of answering the question, but going back a little bit. So I lived in community last year during a service year program, and I think I learned about how important, like, the outreach and like the peer communities can like be when they merge. And I think it's been cool to be here and find other students that are also passionate about outreach and have worked with faculty to promote outreach. And I think when those two communities merge, it produces a lot of really cool conversations and just ways of living, I think. So it's been cool meeting a lot of you and other students and faculty that are sort of part of those.
You know, I'm so glad that I'm the hip one, and I use the word cool. And frankly, you all know I'm not hip, but you know, that coolness, it means that it means something. If you said, oh, outreach is such a drag, I hate outreach, but it's like, it's this idea, and you said something, service. It's service to other people. So that's a really way we're going to come back to this idea of service. So thank you, Delaney, for jumping in there. Ramneet, come on in, because you are unique. And I will say, I've known Ram for going on 2 years, and she is such a joy in my life because she has taught me much about life. But we struggled last year, didn't we, Ram? Because you had to go home early. Talk about this journey that you've been on, frankly, as an international student with us being from our country just north of us. Talk about that a bit.
Yeah, so thank you for the introduction, Dr. Nelson, and hi everyone, it's nice to meet you all. So I think in starting my first year, there was quite a difficult transition, I think, even as an international student. And, you know, even though still kind of from Western society, there were just so many little things that I think I really took for granted being so close to home. I'm incredibly close to my siblings. I'm very close to my parents. And I found that the transition was so difficult because you get thrown into medical school and you kind of just have all these pressures and classes and examinations, and you lose touch with the things that are really important. And I was so grateful that at my urban and community health fair that Dr. Nelson and Josh, who's the M3, presented kind of their work with street life. And it really just pulled me in because Dr. Nelson and Josh were just speaking to an experience outside of constantly studying. And I think that that was really what saved me my first medical school. I think I had the wonderful opportunity to be able to volunteer with Street Life and just gain perspective on gratitude and what it really is to be a physician and serve others, and just the wonderful opportunity that we have to have the knowledge to be able to save someone else's life. It's really a wonderful gift. And I think that that gratitude grounded me for my first year of medical school. So being from Canada, when COVID really got serious, I went back home in March. And that was also a gift for me because I was able to spend more time with my family and also continue that grounding experience. Although I wasn't able to continue my outreach experiences as much, it was grounding to be with my family and to be able to continue that balance of being a medical student, but also understanding kind of areas outside of that. And then transitioning back to being a second-year medical student in Milwaukee has been difficult because you get so attached to your family and your friends, and now it's refinding that balance amongst isolation. So it's definitely been a roller coaster, but I think that the things that I'm grateful for are my connections with family and friends. I think that they have been reinforced in very strong ways amongst the pandemic, and I've been very lucky to have mentors as well, like Dr. Nelson, who have been there for me and continue to ground me. So that's a little bit what my journey has been like.
Yeah, I will comment on this, Ram. I think that you are one of the most reflective persons I know, and I think that it was a blessing to you to be able to go home and reflect on really what's important to you. And you and I have talked about this idea of family and support and community wherever you find yourself, and it is broader than just ourselves. And I think it helps to both ground you and really speak to your heart about what's important.
Absolutely.
Right on. Joshua, come on in.
Hey,
Joshua, it is good to see you, sir. And Joshua, for those who don't know, Josh has been with me since almost week one, and he said, "Hey, I'm going to be on your team." And it's like, oh, great! And he came out and did outreach with us, and now he is our team captain on outreach for Street Life. Josh, welcome to the podcast.
Thanks for having me.
Talk a little bit about your journey to this point. You knew early on what you wanted to do, and speak into that, what you want to do and how it relates to what you're doing as a medical student.
Yeah, so I think like I've known that I wanted to do medicine for quite some time now. The reasons have for sure evolved. So I remember in high school, I tore my ACL and had surgery. And just like remember the orthopedic surgeon walking me through how he was going to fix it and just like being amazed at how cool medicine really was. And like that like really was like the first time in my life where I was like I think that this is like what I want to do. Just because, like I said, I was just like amazed at the anatomy and the physiology of sports medicine and orthopedic surgery in general. So then I moved into college, like still motivated to do medicine. And I was introduced to like this whole idea of street medicine. But like I hadn't like really learned about social justice or like why I wanted to do street medicine. I just like remember like coming across it and like thinking how cool would it be to like save the lives of people who have been thrown away by society. And I kind of took that with me as I applied to medical school and then got accepted and then came to MCW and met you and Max and started going out and volunteering. And like my motivation of like going out and saving homeless people and like those marginalized by society, like quickly turned into like almost me being saved by that community and like just the community of volunteers and the community we have here in Milwaukee, just because it's so easy to forget why we're all here in the first place. And I think that by immersing myself in this idea of street medicine and like really grasping what it means to serve such a vulnerable community has really grounded me throughout these last 3 years and helped save me from like what can be a toxic culture of education and really forgetting why we're here. So I think that just all these experiences these last 3 years have for sure pointed me in the direction I was always supposed to go and have really led me to where I'm at now.
Josh, that was a really well said, and I like the idea of and somebody else mentioned this, saving, and we work together in this space, and we know for those, all of us have worked in situations that require justice, and sometimes there can be saving through handing out of a sandwich to someone, and so we're not necessarily doing surgery in the field, but it matters and it connects deeper than just the idea of health and medicine.
Absolutely.
Right on. I remember, thank you, Josh, Meg Corey, she invited me to coffee when she was a first year. She said, hey, I want to take you to coffee. And it's like, nobody ever asked me to coffee, but you want to have coffee and I'll have coffee. And so we met on it was a fall day and it was raining and we had coffee and she asked me to be her preceptor and I agreed. So Meg Corey, come on into the party. It's good to have you on the podcast. Talk to us as an M4. Because your journey has been winding, if nothing else, in all the things that you have done. Talk to everybody about how everything is starting to fit together as a fourth-year medical student.
Well, first of all, thank you so much for having me here. I'm honored to be a part of this. And, well, it's amazing. I honestly feel like I have the best job in the world. And it's such an honor to be in this position. And after going through medical school, almost done now, it just has all come together in this most incredible way where I feel like I'm exactly where I'm supposed to be. And the impact that we are able to have on other people's lives, whether it's here in the hospital where I am right now on my inpatient rotation, or in the outpatient setting, or just out on the street. It's something that I never want to take for granted and that I hope I never will, because that's what makes this job so special. And over the last few minutes, just listening to all the junior medical students and how they are getting started and how they've gone through their last couple of years, it makes me reflect back on these last few years and how much I have learned, and now realizing how much I still have to learn, and that I'm never going to learn everything, but that's what makes this such an incredible experience, is that I will be continuing to learn more and more every day for the rest of my life, with the mission of caring for other people. And I don't think there's anything better in the world than that.
You know, I'm going to give you a word, and I think that if I know we have said this word to each other, but you are speaking of gratitude.
Gratitude, I try to wake up every morning thankful for the things I have. I've had many experiences throughout my life that have showed me the importance of being thankful for what we have, and being able to express that to others and help them to see the things that they have in their life and use that as a motivation to move forward, to be happier, to be healthier. I feel like that's part of our job too, and it's something that I think isn't taught, and it's often forgotten. So yes, I think if there's one word to describe the way I approach things, it is with gratitude for all the amazing people like you and all these amazing other students that I'll get to work with hopefully in the future. I'm very thankful for everyone and everything.
You will. There was a pastor in the 18th century who said, "What are you willing to weep for?" And I want you all to remember that we should always be willing to weep over the injustices that exist, and to have gratitude in our space of potentially healing some of that injustice. And so we never want to lose that ability to cry over the things that bring us sorrow, as well as those things that bring us joy. And frankly, Meg Corey, you are a joy to me.
Thank you, Dr. Nelson.
Bradley Julga, come on in. Oh, Bradley walked into my office 4 years ago, and he said, "Hi, I'm Bradley Julga, and I'm going to start a community garden, and I'm going to be a pediatrician." And it was like, "Yeah, sure you are." And lo and behold, if he didn't do all of the above with some trepidation, and now Bradley is going to be a pediatrician, as we've talked about. He's going to have honors in community engagement, just as Megan as well. And he has not only started a community garden, but he has turned it over, and it has made an impact on his community. Bradley, talk about some of your journey, and I hope you will, because you and I have spoken of this, if you would incorporate some of your faith journey as well in this process, because I know it is an important thing for both of us.
Great. Thank you, Dr. Nelson, for this opportunity. I grew up on the south side of Milwaukee, and about 6 blocks from my house is a church called Our Lady of Lourdes. And I've been a member of this church my whole life. As an undergrad, I joined their little council. It's an advisory council for the parish director. And this council was looking for a way to engage the community around, not in a way to bring people into the church, but in a way to just be a thriving member of the community, the church as a part of this residential neighborhood. So we sought to find a way to really engage the community, but we were having a hard time figuring it out. And then I met Dr. Nelson when we started medical school, and he was talking about community gardening, because he was telling me all the Cream City Garden projects that are done in the city of Milwaukee, and there's a lot of different organizations that are doing this work. I said, we have this really large green space on the church property, and over the next few months, I was able to work with the staff at the parish, work with the administration, the insurance company, bring in different organizations, including University of Wisconsin Madison Division Extension, which works on agriculture and community gardening around the state. And we were able to break ground by May of my first year. And then now the garden this year, in its 3rd year, is 80% full. And we have a thriving food pantry garden that we share with local food banks. And it satisfies the mission of the parish, which is a place where all are welcome. But it is a community space where the community, the neighborhood, can come together. And it's not, the interesting thing is that it's not just members of the neighborhood. It's people from across the county, people from outside the county who will actually drive here. So you're creating a community within a community. And I think it's also important to, as being a person who grew up in this space, I think an important part of working in a community environment is that you become part of the community by working there. And I think in becoming part of the community, that means that you keep coming back because you feel like you belong.
Thank you, Brad. I appreciate that introduction in that space. Wow, look at this. We're at almost a half hour in and we haven't gotten any questions done. Imagine that. And we had nothing to talk about. I want to start, and you know what? I'm not going to go in any order. So if someone has something to say, and I know you all got something to say, I want to have you think about how you see the future of health. I want to say it this way, because one of our sponsors is the Centers for Disease Control and Prevention. And we have a grant for this podcast that's related to prevention of type 2 diabetes and hypertension, which I did another podcast this morning. 1/3 of Americans, 100 million Americans, are struggling with at least one chronic illness. This is a $13 trillion industry, the healthcare industry. So let's just jump in and say, how do you envision health in the future as you go forward in medical school and when you become a physician?
Okay, I guess like at least for myself, like I envision this next generation of healthcare professionals like entering. I think that because of our education that we're getting, I think that we're going to paint like a much broader stroke of what health is. I think that a big problem with health today in America, just like broadly speaking, is that people, when they think of health, only think of physical health. And I think that it's like much more widely accepted that health is much more than just physical health. Like it involves food, housing security, spiritual health, mental health. And I think that like while that may have been like a focus like over the past like couple decades, I think that our generation of students and future professionals is really embracing that. So I envision that there will be far fewer barriers to care and like a much greater awareness of overall health of an individual.
Cool. Celeste and Ram, you're both giving some really good nonverbals with your head shaking. Come on, both of you, come on in and take it from Josh with what he just said there. He really speaks to the biopsychosocial model, spiritual model as well. And I was hoping you guys would say something. So go ahead.
Hi. So I could pop in, and I wanted to say that I absolutely second everything that Josh said. I think that speaks also to the balance that I was speaking about personally as a student, and how we physicians of the future will be able to kind of pay attention to that in future patients. And something I wanted to add what Josh said is specifically cultural competency. That is a hope that I have for future health, just in terms of being able to better communicate with our patients, being able to better connect them, and understanding how much deeper health goes than just biological health. And you know, this actually makes me think of a quote. My first urban and community health course session, I was learning that approximately 30% of health outcomes are attributed to clinic appointments. And that made me wonder how future physicians can influence the health of a patient on that 30%. And so I think when you kind of dive into the numbers and you just think of the spectrum of health, I think cultural competency is something that's really important to add, just to enhance trust, communication, honesty, building those connections with patients. I think it's something really and something that we should strive for in the future.
Thanks, Rams. Celeste, come on in, and I want you to speak to what you've seen globally. Ram mentioned this idea of culture and cultural competency, but come on in and speak to the idea of what she was saying and anything else that might strike you at this point.
I mean, cultural competency is incredibly relevant on a global scale as well. I think something I was thinking about as both of you were speaking was the idea of education and health literacy, and how being culturally competent when you're dealing with healthcare amongst different cultures, either locally, with immigrant populations, or on a global scale when you're the visitor in their space, understanding how to meet patients where they're at and making sure that people have the understanding and education of what health means to them and what their own health is, so that they can advocate for themselves in health settings. I found that to be incredibly important, and I think that is something that I'm seeing really incredible movement towards, but that is also something I would love to see more growth in as well.
Thanks, Celeste. Delaney, talk about this idea of what she's saying around, because you did a service year, and this idea of health literacy. How does that all fit together, and how are we doing, by the way?
Yeah, I think those are really interesting points that you guys were making. And I think sort of wrapping into that whole conversation of health literacy and social determinants sort of made me think about, especially the health literacy aspect, how we're transitioning into a more like patient-centered type of care, rather than physicians and other healthcare professionals like leading the way and not really giving patients space to be. And so for M1s, we're in this Foundations of Clinical Medicine class this semester. So just sort of getting our feet wet with like, what does clinical medicine look like? What's our role? And on the first day of class, they talked a lot about how important it is to ask open-ended questions, because we aren't the ones that are supposed to be filling the space and the time. It should be the voices of the folks that we're working with. So yeah, I think sort of along those same lines, like creating a space not where like healthcare professionals are like dominating and needing to cure everything, when that's not really always the best outcome if patients aren't really being given a voice or a space to speak. So I think, yeah, I don't know. You guys had really cool, interesting points, and it's fun listening to you guys.
It's fun listening to you too. Meg, I want to bring you in, because you have studied this and you've worked with the diabetes program to end diabetes. What are you seeing around this health literacy that we can take notice of and capitalize in as we go forward?
Yeah, so I guess I'll just give a brief introduction to my background. I run a nonprofit organization called Beat Diabetes, and the chapters that we have around the country are called Diabeaters. Our mission is truly to just provide education to people on health management and disease prevention in new, innovative ways. And in thinking about this, and I love all the answers that that my amazing peers have given. And I think a way that I kind of sum it all up is to think about medicine. I hope, and this is my hope, and I think it's moving in this direction. Medicine, we're realizing now that it is extremely important to consider the social determinants of health, not only in our care planning, but in the education, in health literacy, in the delivery of health care. And the way we do that is through community engagement. And if there's anything I have learned while I'm here at MCW from you, Dr. Nelson, and from incredible people that are working on this at MCW, is that in order to work on making our individuals and our communities and our nation and the world healthier, it needs to start with community engagement and learning how we can better design our current strategies in healthcare to match what people truly need and can access appropriately. So that's something that I've been studying. It's something I'm very passionate about, thinking about it on the patient side and working currently with patients to design education for them and for other patients, but then also working with medical students to provide education to them on how to be better communicators, not just with patients, but with each other, so that all of that goes into this common goal of ensuring that we are doing everything we can to the best of our abilities to work with our patients and care for them, instead of coming up with our own ideas and forcing them upon others.
Yeah, Meg, you really spoke eloquently about that. And for our listeners and the other panelists, Megan was honored with the Medical College of Wisconsin President Awards for community engagement last year. So she really not only talks the talk, but she walks the walk in her programs before this. She's too humble to be able to speak that, so I'm going to brag on her. Bradley, I want you to tie it all together, because we started with what Josh talked about, the biopsychosocial model and spiritual model, and you heard different aspects of this from the panel today. How does that all fit together with medicine and health? And I want to say it this way, because you and I have spoken about children who thrive and children less than thriving. How does this all fit together as we go forward?
It comes from doing this work that many of us are doing here, and honestly, what all physicians, I hope, will do going forward, is they are part of their community. They understand their community, and when you're part of the community, you want to stand up for your community. You want to be an advocate for your community, an advocate on the ground, an advocate in the legislatures, wherever those are, an advocate in their families, in their family lives, in their neighborhood. You want to be present. And I think it really comes back to this point of when I go to a patient room, whether it's inpatient or in the clinics, in the hospitals, I go to the patient room and I check myself. And it's like, what am I bringing with me at this moment? What am I, where am I at? So that when I open that door, I am trying to push those things, to not push them. I'm trying to be open to the interaction that I have with the family, with the child. It comes to this point that's cultural competence as well, something that was brought up by my peers here. And I think the cultural competence, unfortunately, is something that we don't receive enough education of, and I think in medical school in general. And it honestly, having been out in the rotation sites and in the hospitals, it worries me to see the degree of the current physicians and the current medical system and the degree of cultural competence that exists. And I think we all have a role to play in to help each other and to show each other, is that none of us are perfect in this regard, to show each other how to be truly culturally competent, and so that we can all grow together in that regard. And this kind of ties into being a member of the community. So if you're a member of the community, you have a better understanding of the cultural competence that's required to be a member of that community. You have an understanding of what you can bring to the table, and you can be an open member of that community, sharing between communities and really trying to work to really just benefit the lives of people. I think in the medical field, we have a tendency to put pressure on individuals, to put pressure on them in terms of our plans, like this is the best thing for you, and I think it's important to meet them where they are at. And I think through the cultural competencies we learn from our peers, we're in a better position to make that happen.
Yeah, this is one of those things, and when I thank you, Bradley, for that. When we talk about this idea of cultural competency, and one of my colleagues who just retired, Dr. Ernestine Willis, said, "We will never be fully culturally competent," and especially for people who come from white America, we will always be growing in our edge of cultural humility, or excuse me, cultural competency. And so we need to attend to it through the idea of cultural humility. I want to ask each of you to speak into this. I want you to think about what this phrase means to you. And let's just kind of riff on this and we can build on each other. And I'm going to start with Delaney this time. When you hear the term community engagement and medicine, what comes to mind?
I think relationship is sort of like real, authentic relationship is sort of the first thing I think of. And I think without that authentic relationship and trust built up, I don't really think medicine can happen, at least not medicine that's very helpful for the patient. So I think it extends beyond just a service mentality of like providing care or serving people. I think, yeah, authentic relationship that's mutual and that means something for both people. Sort of the first thing I think of.
That's deep, Delaney. I appreciate that, especially the idea of authenticity. You don't know it till you're in it, right? Right on. Joshua, community engagement in medicine, what's it mean?
Honestly, like I think that Delaney like summed that up pretty perfectly. Like when I think of community engagement in medicine and like my journey thus far, I think like she hit the nail on the head. Like the first step is those authentic relationships where you build that trust between two people and community and provider. I think that like the key to that is just consistent presence. I don't think that you can be community engaged without being in the community, to my knowledge. Like being present is like the biggest part of community engagement. Because without being present, like if someone sees you once a month or once every couple months, like they're not going to get to know you on the level that someone needs to know you to like really form a relationship that is necessary to like know each other or like really trust each other on a level that is appropriate to share health information. And I think that at least like from my experience with like those experiencing homelessness, like those people, a lot of people have been like so taken advantage of and marginalized by like the healthcare system and our society in general. I think that those relationships and trust are like just so vital because like I said, just because they've been taken advantage of, like there's like this like in general feeling of distrust for everyone in that community. So by really building that trust and being present, I think you can be community engaged and like begin medicine in that way.
Yeah, that word present was really important to me. Bradley, come on in because you were nodding vigorously when Josh was speaking. Take it from him.
I sure was. A word kind of jumped in my head hearing both what Josh and Delaney had to say, and I know Delaney said authenticity and being authentic, and another word popped in my head was intimacy. Having an intimate relationship with your patients, and in regard to them feeling like they can trust you and you feeling like you can trust them, because it's a give and take in this patient-physician relationship. It's a give and take in the community work we do. Just like Megan was saying that she has this gratitude, and I'm sure the people that she helps have gratitude for her. And I just wanted to say that intimacy is a key component of being a physician, and the ability to establish intimacy is paramount in our care and our ability to provide good care and get a good, really understand what a patient brings to that appointment. So I just wanted to add that as a point of value for us going forward.
I love it, and because it's that idea of you're working with people on some of their most scariest things, things that frighten them, the things that give them joy. Ram, come on in and take it from Bradley about what does community engagement in medicine mean to you?
Yeah, absolutely. And building off of what everyone has said about intimacy relationships, I think humility is something that really stands out to me when it comes to community engagement. And I actually just want to share something that really it kind of is the reason why humility is brought to the forefront of my mind. In my first year of medical school, we had an interprofessional session where we had future physicians, nurses, and pharmacy students all come together, and pharmacy students and nurses were able to anonymously submit kind of any thoughts or feelings they had about who physicians were and how they were with patients. And one of the some of the words that really popped up were things like arrogance, being self-absorbed, which are awful things to hear, that these are still, kind of words that are associated with us. And when you take that kind of as an extension further, how must patients feel then if our peers and colleagues feel that way? How must marginalized population members feel when it comes to us? So I think that was incredibly eye-opening, and that we have such a long way to go to really make connections with patients whose voices are not heard. And to me, bringing ourselves lower and being humble, allowing ourselves to learn from these members in our community, learning how to best serve them, learning how we can change ourselves, just continuing the self-reflection process, and just mirroring what Megan said as well in the beginning about how we will never know enough, we will never know everything. So just to continue the learning process through humility. So yeah.
I reacted internally, maybe externally too, when I review this, when you said arrogance, and it's like, oh, arrogance and humility don't go together. They are the absolutely opposite from one another. Celeste, I know you're a deep thinker, and you were thinking when each of the other people were talking, and I was looking over you, but then you were nodding when Ram was talking. Take it from Ram to say, community engagement in medicine, what's it mean to you?
Yeah, well, I was nodding a lot because Ramneet, I was going to say humility as well. I also have an anecdote. When I was working in Tijuana at the border, I was coordinating the clinic down there. So one of my roles was to, orient the providers that would come down to help. And we would have people come for a week to a month to a few months. And, I had many different doctors come down, and some were more than happy to do work that was completely unrelated to medical care if that was needed. And some, when I would ask them, for example, to take vitals up at the front, would be upset that they weren't seeing patients directly. And so I was reflecting on that, listening to all of you talk and thinking about how if we want to engage with the community through medicine, it might not always be directly related to medical care in every act that we do. Community engagement is community engagement. And then we can also incorporate medicine in certain ways. And so incorporating humility, not coming in with an ego. And like you've said, Dr. Nelson, many times, like there's no saviors here. We're not, we're not gods. We're not, doing this to boost our egos. It's part of being on a level playing field and developing that trust. So that's what I was thinking about.
I appreciate that. We have another saying that you'll hear me say, leaders mop.
Yes, I love when people are open to doing any kind of work. There's nothing.
Leaders mop. Megan, I want you kind of started this, and I want you to end it. And I don't care, really, I do care. I don't have a preference about how you wrap this up, because just kind of summarize what you're hearing here, because you are the most humble, least arrogant, you really do cry over the injustices that you have witnessed. Wrap it up for us in this particular segment with what you're hearing from your colleagues.
Dr. Nelson, you're gonna make me cry now. I love all the answers everyone gave. And I think the way that I think about community engagement, and I think it kind of sums up what everyone was saying, is that it is a respectful, meaningful, and very active collaboration. It means that we are not the only ones actively doing something in this relationship. We are taking a conscious effort to involve the other party and have them play an active role in our work together. So when I think of community engagement, I think of collaboration, I think of togetherness, and I think of something that my parents have told me and my brother since we were kids. And there's a way to say this in another language. It doesn't translate that well to English, but they say sometimes the best medicine you can give someone is your ears and your heart. And I truly believe it. And I've seen it, again, just here in the hospital. I took some time to sit with one of my patients who was getting hemodialysis, and he was in a lot of pain from multiple things. He had a really bad fall, and so taking pain medications. But he told me that on the days that I come and sit with him, and we don't talk about his health or anything, we just talk. I just get to know him. I know a lot about him and what he does outside for his work and the things he cares about and the things that motivate him. He told me on the days when I come to sit with him and talk with him, he doesn't need his pain medications. So that, I think, is a very small and minuscule example of community engagement. But if we can do that with more people and with our communities and really just stop and listen and learn from them, it goes beyond anything we can do in medicine.
I'm supposed to have something to say, and I don't think I do. Megan, thank you. That was quite beautiful. Oh, wow, look at this. We got to one question. What a joy each of you are, and what you add not only to this podcast, but add to my learning and my life. Even though if you've only been here for a short time, Delaney and Celeste, you two are contributing to my learning and my life, and it is a joy. Delaney, Weiland, Celeste Payne, Ramneet, Mann, Josh Matzke, Meg Corey, Brad Julga, thank you for coming on the Days of Learning podcast. I hope as we go forward that you will come on again and we can talk about some concepts that really matter, not beyond this, not that these don't matter, but we'll talk a little bit more about in-depth. And I'm almost sure that the healthcare space is going to be just fine. And I'll say this to each and every one of you. You can put me on your panels of when you care for me, you can care for my whole family. So thank you guys for coming on the show today.
Thank you, Dr. Nelson.
Thank you for having us.
Thank you. It was a pleasure.
Wow. That was so life-giving. It was so engaging to hear about the journeys that each of these leaders has been on and will be on in the space of health, community engagement, medicine, and how we build a more equitable society. I hope you enjoyed this session, and if you liked it, I hope you'll give us comments. If you're interested, you can subscribe to the show, the Days of Learning podcast, on YouTube. I'm your host, David Nelson, and we thank you for your commitment to excellence in the community. Continue good health and blessings to you and yours. Bye now.